Inflammation. So inflammation is of two types. First type is acute inflammation. Another type is chronic inflammation. Acute inflammation and chronic inflammation. These are two types of inflammation. Acute inflammation has different types, and chronic acute inflammation is the in type of inflammation which occurs only for days to weeks or month. That is why it's known as acute inflammation. It is response to eliminate the cause of cell injury. When cell injury has happened, now that cause has to be eliminated, and to remove the necrotic cells result into repair, and it is divided into acute and a chronic type. Inflammation, uh, including septic shock, TB, autoimmune diseases such as SLE, systemic lupus erythematosus, and cardinal signs of inflammation are rubor, Keller, tumor, dolor, function loss. Yeah. Rubor means redness due to vasodilation, warmth due to vasodilation. Tumor means swelling due to endothelial contraction, disruption from tissue damage, more protein leak, interstitial oncotic pressure is increased, and endothelial cells contraction is mediated by leukotriene D4, C4, histamine, serotonin, and bradykinin. That's why tumor happens. And dolor means pain is synthesized by sensory nerve endings mediated by bradykinin, prostaglandin E2, and histamines. So this is the thing which is very important to memorize, that prostaglandin E2 and histamines mediate the inflammation. Another one is function loss. Function loss inflammation impair the function inability to make due to cellulitis is a function loss happens. Fever occurs in inflammation because of LPS and macrophage inducing IR release of interleukin 1, tissue necrotic factor, prostaglandin E2 increased temperature, and COX inhibition activity has increased. Anterior hypothalamus causes temperature that results into the fever and inflammation. Then another one is leukocytosis. Leukocytosis is a condition, increase in the WBC count and increase in the neutrophil count, increase WBC that results into margination, rolling, adhesion, and transmigration. Another one is increase acute plasma reactant protein that causes uh, noticeably induced interleukin 6 and causes inflammation. So acute phase reactants are reactants that have C reactant protein, ferritin, fibrinogen, hepatoglobulin, hepcidin. Downregulation of acute phase protein are albumin, transferrin, and transthetin. Another one is erythrocytic sedimentation rate. It is a rate at which RBCs are settled down due to loss of negative charge, that is known as erythrocytic sedimentation rate. So, while normally cells have negative charge appearance, and in ESR increase, these cells have uh, loss of negative charge due to inflammation. They clump together and they causes increased sedimentation. Occurs in anemia, infection, inflammation, cancer, renal disease, and pregnancy. ESR is increased in all of these conditions. Are uh, in decrease in ESR occurs in sickle cell, polycythemia, heart failure, microcytosis, and hyperfibrinogenemia results into decrease in ESR. So this is the condition, and